Thank you. As I think you all know, the good news on the Isle of Man is that we're now well beyond the 100-day point when we last had a community case of COVID. And you'll also know that we've had 3 positive cases reported by the lab, 1 a week ago Saturday, 1 Saturday, and 1 this morning. So how do those differ from community cases? 2 of them are people who had travelled back home from the UK and opted to do a day 7 test, which is a new pathway that's been offered only for about the last 2 weeks. Is everybody familiar with that? So I don't need to say any more about what that is. So neither of those 2 individuals had any symptoms at all, and they obviously opted for the day 7 test in the hope that that would confirm they were negative, and then they could have relaxed self-isolation for the remainder of their 14 days, and clearly both tested positive. So what has happened with them is they have both been served with notices that require them now to complete another 14 days self-isolation, which is really belt and braces in terms of making sure they're not out and about while there is any risk that they are still actually shedding virus and being infectious to other people. Obviously, the contact tracing team has also then swung into action to follow up contacts to make sure that anybody who is at high risk is also then self-isolated, and that will stop any risk of onwards transmission. So in those cases, we're actually very confident that that has been done and that there are no worries about starting a chain of onward transmission that could take us back to community spread. The case that was diagnosed this morning was slightly different in that it's an individual who is based in the UK, but who came across on an exemption certificate to carry out specialised maintenance of kit that couldn't be done by anyone here. They arrived on island this morning and have been tested this morning with a rapid test, and they are now self-isolating at an approved hotel address that will enable them to do that for the 14 days. So the key message from that is that as soon as you start testing people who are coming in from an area with high levels of infection, we are going to find positives. So it's not something that has at the moment any implications for what we need to do on island in terms of stopping onwards transmission. Obviously, we can't say that that won't change, but at the moment, we are confident that with the numbers we're seeing, we can manage that with the test and contact trace system. We've updated ministers on what the numbers look like across and what that means in terms of the number of cases we would expect to get here. And ultimately, it's for ministers to make a call on whether they feel that means they need to modify the border arrangements and maybe, you know, suspend the day 7 testing, make everybody do 14 days self-isolation, or restrict even further people coming on island or leaving the island. But that's a call for ministers. So that's where we are at the moment. So we are still in a position here of no current community transmission, so no need for any social distancing or other mitigations to be re-implemented. But I think the message from that is that it can come back. One could be pessimistic and say, you know, it likely will come back, and therefore I think everybody needs to be in a state where they can re-escalate all the plans that we put in place earlier on in the summer before we were able to say that we didn't have the community transmission. We would hope that we won't have to go back at any point to a complete island lockdown, and we would hope that if we spot local transmission, even local clusters of transmission that's related, that we can deal with that with a local response, which could be closing a class, it could be closing a school if it's a school associated issue, or potentially, you know, closing a pub or restaurant venue or whatever is indicated by the nature of that outbreak. But as you'll see when we do the tabletop exercises for the outbreak plan, it will be very much something that is done in collaboration with those who are relevant to it. So schools, if it was an outbreak that involved any school issues, the head teacher and desk appropriate people would be very much part of the outbreak management and decision-making process on that. So rest assured on that. It would be key to any decisions that are made. Okay, I think that's kind of the background, so I'm happy to take questions.
Can I ask a question? We're not operating any bubbles whatsoever. Schools are just running as schools as normal. Do you think maybe we should be thinking about that?
I think that would be a good thing to do. Yeah.
Now, before?
Now, yes. You don't have to start doing it, but if you have a map of what it would look like if you needed to do it.
Okay, that's interesting.
We were told at cluster meetings last week that if there was a case in our school and we are notified by the Track and Trace organisation, that we wouldn't be told the name of the person who's tested positive, nor any idea of which year they belong to. Now, in a secondary school with no social distancing, that effectively means that I would have to close the school to be sure.
Yes, I'm not sure that that's entirely accurate what you've been told there. We cannot disclose personal identifiers, so we couldn't give you, name, address, date of birth. I understand that we can give you the information you need in order to respond to the public health threat, which clearly does have to be about year group. I would also stress that the young person or family for a child will be very much expected to notify the school themselves.
Yeah.
So we should be able to manage things that way. If there is any sort of breakdown and for some reason it doesn't work, then ultimately we do have public health powers that would enable us to do what is needed to protect the public's health.
In a secondary school setting, that really wouldn't be telling us who it is, because in a secondary school setting, as you know, the students go everywhere. We don't know where they will be from one minute to the next, effectively. And they're set in different groups and different classes and change around all the time, move completely around the school, theoretically, in the course of a day.
Yeah.
So is there any way that we could, on the basis of the public health requirement of such information, urge the contact tracing team to let us know exactly who it is?
They won't be able to give you the actual name and details because that is contravening GDPR. They will obviously have identified all the close contacts, and actually when the school is notified that groups will be missing, that actually will identify it for you, and we would work with you to enable the decisions to be made appropriately without actually taking the step of disclosing a specific name.
How quickly would that happen?
Very quickly. As soon as the laboratory result is notified to the contact tracing team, they get into contact with the case, parents. Obviously, secondary school, one would expect that the young person would be, GILIC competent to liaise directly with contact tracing, because clearly their parents aren't going to know the sufficient level of detail there. But if we had any inkling that there was any block being put in place, for example, I would very much doubt that anybody would, because why would they? But if there was any indication of that, then we would look to mitigate that using, the regulations, and also, before we swung into regulations, just by, engaging and explaining to people why this is important.
Let's pick up on the bubbling question.
Martin, can you speak up?
Sure. The bubbling question that Carol mentioned earlier on, obviously it's a concern to if we start doing that at school now, it's going to create a lot of parental discussion. Can you give us some idea of what sort of priority you place on that? For example, we could separate infants and juniors, or we can separate classes or groups of classes. Obviously, there's a knock-on effect and implication in terms of whether one has a school happens to. Yeah. Recommendation?
I think the way to start on this would really be to look back at all the arrangements that were agreed to be put in place back earlier in the summer. It's an awfully long time ago now, and that would be a good starting point. I think there is something about being open and honest, all of us, in terms of saying, we're COVID free at the moment, but we have no guarantee that it's going to stay that way. And obviously it's better for everybody if we actually have a contingency plan that is ready to go as soon as it might be needed. Let's hope it isn't needed, But if it is, then instead of, you know, having to try and pull it back together somewhat from scratch, everybody is actually clear exactly what would happen. And that's kind of the underlying approach within the whole outbreak response plan, as you'll see when you do the tabletop exercises.
It's more for the record that I'm saying this, but reverting back to the plans in the summer in secondary school are more problematic and demanding, because plans in the summer were made on the basis of 2 year groups not being there. So that's quite a substantial undertaking for secondary schools, which almost certainly would have to close in some form for some year groups, if not the whole school, in the case of an outbreak.
Yeah. I think this may be something that would be well raised at the tabletop exercises, so that you can actually flag it as something that you need to work through to establish the principles of what you would do, because I can see what you're saying there with the added numbers. It does make it a different order of magnitude.
Jamie?
On the COVID-19 website, it mentions the self-isolating, if you're living with someone, the self-isolating shouldn't go to work. So I'm assuming our teachers, if their partner is self-isolating, they shouldn't.
If it's somebody who's self-isolating because they are a confirmed positive, then the whole household needs to be self-isolating with them. At the moment, if you're self-isolating because you've come back from across and you are self-isolating within a household, then the other members of the household can go about their normal business.
It doesn't say that on the website, they recommend it.
I think it does.
So it's my call as a teacher, so I've got 2 children off.
Right.
Because they're living with someone. Now I've got a member of staff who's going to be in a similar position next week. I don't know whether they should be allowed them into school or not.
It's a very difficult call to make. The website does actually say that if you're self-isolating because you've returned, then the rest of your household don't have to self-isolate with you, so long as you're basically, you know, undertaking to keep self-isolated. And it is difficult because it comes down to a matter of trust. And also, I think it's fair to say that some properties are easier to kind of self-isolate in than others. You know, if you've got ensuite bedroom, bathroom facilities, for example, it's easier than if you're sharing a bathroom. So there is a call to be made there, and I think it's difficult for that call to sit on the shoulders of individual employers, but at the minute that seems to be the way it's been agreed to be done.
Sorry, I've got another question. I sent a child home today with symptoms. Obviously we don't know until if the person is tested whether or not the person is tested positive or not. What happens to the rest of the family living with the child pre-confirmation of whether it's a positive case?
They should all be self-isolating until they get the confirmed result.
And
if it's kind of mixing with Jamie was saying, having had 2 cases confirmed where they were asymptomatic and I'm concerned about the amount of parents that travel away from work and come back, and actually they could then come back, not have the test for 7 days, be asymptomatic, and their children are coming into school. I don't know, should I be worried about that? Or?
It's a question of the level of risk and the assessment of what that risk is compared to the risk to the economy and social, mental health and well-being and all the rest of it, of allowing some managed movement. Now, that parent in that scenario who's been across, comes back, they should be self-isolating in their home. So they should be not interacting with other family members. They should be confined to their own room. They should be sleeping alone. Ideally, they should have an ensuite bathroom facility that they can use, meals left by somebody else outside their door, or go and make their own meal at a pre-arranged time when they won't interact with other family members in the kitchen or even in the communal areas getting to the kitchen. That's quite a tall order, and it does rely on trust. I can't really say anything other than that. Sorry? Well, it's non-enforceable. And it is a really difficult one, because the alternative is we do like New Zealand and Australia, or we do like we were doing here originally when people had to stay in the comis. you know, for their period of self-isolation. And there was an awful lot of kickback against that, as you know, you're probably aware. And that was why the call was taken to relax it. And first of all, you could go back into your household if other family members self-isolated, and then it was relaxed further. Now, those relaxations were done at a time when the rates across were falling and or looked stable. Now, this is a constantly changing backdrop, and unfortunately at the moment, the rates across look as if they're going up. So, you know, ministers are aware of this, and they will be reviewing things. And one of the things they will obviously be keeping under review is whether we need to change the border arrangements in light of the shifting background risk that's sitting across now, because that's where it will come from, if and when it does come.
Is there any plan then to look at what other jurisdictions are doing and test on entry or re-entry? Because surely this situation being locked on the island can't be sustained over time, surely.
Yeah, I know. The problem with testing pre-entry or on your day of arrival is that test is only as good as the day it was taken. The incubation period for COVID is 14 days. So you could be tested on arrival, having caught COVID, you know, anything up to 14 days before. No, I'm getting my numbers muddled up. You test negative on arrival, and you could still manifest the virus over the next 14 days. So it doesn't give you a piece of information that actually lets you say with any confidence, this person is clear of COVID, they can go about their business out into the community. Doesn't let you do that.
The 7-day test then, does that say if it's got 14-day information?
Yeah.
Does that 7-day just kind of give more of an idea?
It gives you more of an idea. The gold standard still has to be 14 days from the day you arrive on island. That is quite onerous. It's particularly onerous for people who have to go back and forth for business. So there's been a lot of pushback on it, and a lot of pushback on that came from, you know, businesses and business representative organisations who were very much wanting, you know, testing on arrival, or you get tested before you come and you can be then exempted from self-isolation. For the reasons I've said, that is not very good. When we look at the modelling, when you arrive on island, you could be a person who is already anywhere you like in that 14-day period, and you can't kind of model that because it will differ. You know, sometimes you could get loads of people who are, you know, nearing the end of it, or another time loads of people who are near the beginning of it. You also have the group of people who got infected during travel, and travel actually is a very high risk event contracting COVID, because you're mixed up with lots of different people from all over the place. So it's a big kind of spreading event. If we try and model, and there have been mathematical models that try to look at, can we estimate the number of people who get infected on the day of travel, plus the numbers who may have been infected in those up to 14 days before they travelled, and see how that looks for how they would test on the days subsequent. If you test on day of arrival, you would probably only pick up something between 5 to 10% of positive cases. So you could, you know, exclude them by quarantining them, but you've potentially let out around 90% of people who are still going to become infected. If you test on day 7 with the result on day 8, the modelling suggests you would pick up something between 90 and 95% of those who are infected. So you've still got the risk that you're letting out maybe 5 to 10%. That's why we've only gone for modified self-isolation instead of saying, you know, go about life absolutely as normal. So we've still got a modifier in there, but it does mean that there is that small risk that community transmission could result.
So another, sorry to ask so many questions, I've got a lot of questions about this, but another island jurisdiction, Jersey, got different rules. They've allowed 57,000 people to travel on and off island, 43 cases. Is the Isle of Man looking at something along those lines of a more nuanced approach to border restriction to allow us to get back to some kind of normality? My fear is, quite apart from the fact that I've got family across who ideally love to come here, and we've got teachers in my in school who want to go across. We've been asked to find out how many, for example, want to go at Christmas. Over at least a third of my staff would like to do that. Given those tensions now, is it not time to be looking at a more nuanced approach towards border control on the Isle of Man, which observes all the things that you've said, keeps us all safe, but allows a bit more freedom to travel?
Yes, the other side to that would be that we would need to reinstitute some of the physical distancing and other mitigations as they've kept in Jersey, for example. So it's really a question of, do we want to live life as normal on the island as we are at the minute? No restrictions, no need for face coverings, no social distancing, etc., etc., and accept quite restricted border arrangements? Or do we want to take a more Jersey approach, still maintain quite a lot of those other mitigations which do impact on how we live our lives on island, but have a freer travelling to and from? And that's ultimately, at the end of the day, that's a political decision rather than one for public health.
Absolutely, and it depends on your definition of what's normal.
Yeah, yeah.
Thank you.
Can I ask a flu question? Sorry, because I know that it's not COVID, but I've had a parent who said that the child's not having the flu vaccination in October, and that this is a live vaccine and it will shed for up to 28 days, and they want to keep their child off school in the main shedding period. Is this true? Because otherwise, if it is true, will staff be at risk from a live vaccine?
No, it's a live attenuated vaccine. So it does not infect people like flu would. It's not, giving you...
So it doesn't shed?
I will check.
Right, okay. I just want to check because they've asked to take the child.
I will get you the
you.
fullest evidence-based answer for that. Brought my laptop for that very purpose. No, it's a good question, and I don't want to, risk giving an incomplete or incorrect answer.
Has anybody else got any questions?
Jane did.
Go on, Jane, fire it out while Henrietta's looking.
At the prevent stage, I know the cleaning is quite an important part of our mitigating approaches. How do we advise that happening in schools, and how does it happen in other government departments such as the hospital and pharmacy?
Okay, so I'll go back to the shedding issue. Yes. This shedding claim is actually a very well-used anti-vaxxer argument.
Oh, okay.
It's very well known as one that they habitually use. They've used it with measles, mumps, rubella, and it's coming back again. Shedding is a real phenomenon. It refers to a period of time during a viral infection when the virus is coming off the infected person and is capable of shedding other people. Live attenuated viruses, so that is flu vaccine, live attenuated vaccines, so that's like flu and it's like measles, are treated to be weakened so they cannot cause an infection, but they still reproduce enough in the individual who's been given them to stimulate an immune reaction, okay? So they're at that sweet spot. So they do not pose any risk of infection to others.
Thank you. Thanks for finding.
And then the other question was around cleaning
Cleaning.
arrangements, and is there anything we need to be mindful of, and how it compares with other government departments. Is that right, Jane?
It's just this prevent state, it's enhanced cleanings.
Mhm.
Talked about, and I was interested as to what the hospital are doing that's different to normal infection control, are they still operating at an enhanced level?
I don't honestly know the answer to that because we're now part of the Cabinet Office and not DHSC, so we're not that close to what they're doing within Nobles. In terms of cleaning and hygiene, I think the overriding message is that the hygiene messages need to remain as they were during COVID, which is anybody that's got any symptoms should not be in school or work or going out into the community. Everybody should continue to follow respiratory etiquette, which is sneeze or cough into a tissue or your elbow, frequent hand washing, and just generally maintain vigilance. So at the moment, because there is no circulating virus, there is no specific reason to recommend any enhanced cleaning, but bearing in mind that we're heading into flu and norovirus season as well as COVID, anything like, continued vigilance in terms of frequent sanitizing of high-touch surfaces, etc., would not be a bad idea for all those viruses, not just COVID.
Thank you. Ladies and gentlemen, on all of your behalf, I'd just like to thank you, Dr. Ewart, for taking the time this evening in what I imagine is a very busy schedule to come and speak to the head teachers. It's not the first time you've addressed our branch of head teachers and senior leaders, and we all are very much appreciative that you're doing this.
It
Thank
really
you.
is a pleasure to come and work with you. And all I would say is take the opportunity at the tabletop exercises to double test some of the things that we've raised today, particularly around sort of implications for secondary school and maybe how you might start planning for bubbling, etc. And apart from that, if anybody has any further questions, just email me and I'll endeavour to answer them.
Brilliant. Thank you very much for your time on behalf of all of us. Thank you.